Good morning, Dixon Clark. I am Mihiraa. Let's start the warm-up sessions. What are the different roles of a nurse?
A nurse plays different roles in her profession. The primary role of a nurse is a caregiver. Apart from this role, she functions as a mediator, advocate, counselor, educator, and the like. A nurse plays a very crucial role in the healthcare system, connecting various departments in the industry for the welfare of patients.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are very essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I like to give to future nurses.
Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
Tell me a quality that you possess that suits your profession.
I think I have excellent communication skills which help me to interact with my patients professionally. Apart from this, it also helps me to maintain a good relationship with my colleagues. So I think this is the one quality which suits my profession.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
Your preparation time is over. You can now start the role play.
Good morning, Mihiraa. How are you feeling today?
Good morning, Nurse Clark. I'm feeling a bit better, thank you.
That's great to hear. I'm here to check on your recovery since your surgery. How have you been managing since the operation?
It's been a bit tough, but I'm getting through it. There's some discomfort, but I guess that's normal.
Yes, Mihiraa, a little discomfort is to be expected. I'm here today for a couple of reasons: to observe your clinical progress and to discuss your post-operative care. First, I understand this is a sensitive topic, so let's talk about some very positive news from your surgery. The doctors were able to remove the tumor completely during the operation. This is fantastic news because it means your recovery will likely be much smoother. One of the benefits of such a successful surgery is that you might not need any additional radiation treatment. This can significantly reduce the overall treatment time and potentially shorten your hospital stay. Of course, Mihiraa, everyone reacts differently, so I completely understand if you have any questions or concerns about the outcome or what it means for your recovery. Please don't hesitate to ask anything that's on your mind. I'm here to help you feel as informed and comfortable as possible.
That's such a relief to hear. I was worried about the need for further treatment. I'm just a bit concerned about the pain and how to manage it, as well as what I need to do to take care of the wound.
Absolutely. Now, Mihiraa, let's talk about how you'll manage comfortably at home after you recover. We'll have pain medication available to keep you feeling your best, and we'll show you exactly how to manage any wound care needs. It's a simple process that you can easily handle on your own once we demonstrate it for you. Once you're discharged, we want to make sure your recovery continues smoothly. This might involve avoiding strenuous activities for a while, which allows your body to focus on healing. We'll also recommend a balanced diet to provide your body with the essential nutrients it needs to recover quickly. Most importantly, it's crucial to continue taking any medication exactly as prescribed by the doctor. This will help ensure a complete and successful recovery. Remember, we're here to support you every step of the way. If you have any questions or concerns about managing at home, please don't hesitate to ask. We want to make sure you feel confident and prepared for a smooth transition back to your daily routine.
Okay, that sounds like a plan. What are the next steps in my recovery?
Now that we have this positive news about your surgery, Mihiraa, it's the time to talk about the next steps in your recovery. We'll continue to monitor your progress closely, checking things like pain levels and vitals. This helps us ensure you're healing well. An important part of recovery is making sure your wound heals properly. We'll provide you with all the information and support you need to care for the wound at home. Once your wound is healing well and you're feeling strong, we can start discussing discharge planning. This will involve getting you set up for a smooth transition back to your daily life. Of course, there's no set timeline for discharge. We'll work together to ensure you feel comfortable and confident before going home. I hope it is clear to you. Do you have any other questions or concerns?
Not at the moment. I feel much better knowing what to expect.
That's good to hear. Your doctor will visit you shortly to discuss your recovery plan in more detail and answer any further questions you might have. You're doing great, Mihiraa. We're here to support you every step of the way.
Thank you so much, Nurse Clark. I really appreciate it.
You're very welcome. Rest well, and we'll be here if you need anything.